Let me start with a question. Raise your hand, mentally if you'd rather, if you have a small, waxy, stuck-on looking brown or tan spot somewhere on your skin that's been there for years, maybe getting a little bigger or a little darker over time, and you've never quite asked your doctor about it because, well, it doesn't hurt, it's not bleeding, and you've just gotten used to it being there. If your hand went up, even mentally, you are in very good company. In fact, you're in the company of the majority of adults over age 50, and a great many younger than that too. Good morning, afternoon, evening. I'm a physician, and I want to spend the next few minutes with you talking about one of the most common things that brings people into a dermatologist's office. Not because it's dangerous, but because it's annoying. It's called seborrheic keratosis, and lately my inbox and my clinic visits have been full of the same question, usually asked a little sheepishly. I saw an ad for a gel that melts these things off at home. Does it actually work? I think this topic matters not because seborrheic keratosis will ever threaten your life, it won't, but because it sits at the intersection of something very human. Our skin, our self-image, and our vulnerability to a confident marketing claim when we're a little insecure about how we look. My goal today isn't to sell you anything or scare you about anything. It's to hand you the actual evidence in plain language, so that whatever you decide to do about those spots on your skin, you decide it with real information instead of a slogan. Introduction to the topic. So, what exactly is a seborrheic keratosis? In the simplest terms, a seborrheic keratosis. We'll call it an SK for short, because doctors love our abbreviations, is a benign, non-cancerous growth on the surface of the skin. It's made up of ordinary skin cells, specifically a cell type called keratinocytes, that have piled up on themselves in an overgrowth that looks a bit like a wart, a barnacle, or a drop of warm candle wax that's dried onto the skin. Some people call them age spots or wisdom spots, though technically that term is often used loosely for several different kinds of skin marks. They're usually brown, tan, black, or sometimes a lighter flesh color. They can be flat at first and then become raised, rough, and slightly greasy or waxy in texture. They range from the size of a pinhead to well over an inch across, and they can show up almost anywhere except the palms of your hands and the soles of your feet. Here's the fact that surprises most people. Seborrheic keratoses are not rare at all. They are one of the most common benign skin growths in adults, affecting tens of millions of people, with the numbers climbing steadily as we age. Some studies estimate that the vast majority of people over 70 have at least one. Many of us will eventually have several, sometimes dozens. Why should you care about something so common and so harmless? 2 reasons. First, cosmetically, they can bother people a great deal. On the face, the neck, the chest, anywhere visible, they can affect how people feel about their appearance and, in documented studies, measurably affect quality of life. Second, and this is the more medically important reason, because SKs can sometimes resemble other, more serious skin conditions, including certain skin cancers. That's why just clearing it with a gel at home is a more loaded decision than it first appears, and that's really the heart of what I want to walk you through today. Let's get a little bit into the biology, but I promise to keep it simple. Your outermost layer of skin, the epidermis, is constantly renewing itself. Cells are born at the base of this layer, mature, flatten out, and eventually shed from the surface, a cycle that normally takes about a month. A seborrheic keratosis happens when a patch of these surface cells stops following the normal grow, mature, shed schedule and instead piles up in place, layer upon layer, like leaves accumulating in a gutter instead of washing away. The result is that waxy, stuck-on plaque you can sometimes almost peel off with a fingernail, though I'd strongly recommend you don't try. What causes this pileup? Honestly, we don't have one clean, single answer, and that's worth being upfront about. We know a few things clearly. Age is the single strongest risk factor. The older we get, The more of these we tend to accumulate, which is part of why they're sometimes lumped in with terms like age spots, even though true age spots, sun-induced flat brown marks called solar lentigines, are technically a different related phenomenon. Genetics plays a real role. If your parents or siblings have a lot of SKs, you're more likely to develop them too. Certain gene mutations, particularly in a growth signaling pathway called FGFR3, have been identified in SK tissue, which helps explain why they cluster in families. Sun exposure appears to be a contributing factor, especially for SKs that appear on chronically sun-exposed skin like the face, neck, chest, and forearms. Although, and this surprises people, SKs also appear plenty in places that never see the sun, so ultraviolet light is a contributor, not the whole story. Friction and skin folds seem to matter too, which is why you'll often see SKs in areas where skin rubs against skin or clothing, under the breasts, in the armpits, around the waistline. Here's an analogy I like to use with patients. Think of your skin's surface like a brick wall that's supposed to be rebuilt brick by brick, with old bricks removed as new ones go in. In a seborrheic keratosis, it's as if, in one small patch, the construction crew keeps adding bricks without ever taking the old ones away. You end up with a little raised mound, not because anything is invading or attacking your skin, but because the normal renovation process in that one spot got stuck in build mode and forgot to demolish. Critically, and I want to say this clearly because it's the single most reassuring fact in this whole talk, seborrheic keratoses are not skin cancer, and the overwhelming body of evidence shows they do not turn into skin cancer. They are biologically a benign overgrowth, full stop. That doesn't mean every spot that looks like an SK actually is one, which brings us to warning signs. Symptoms and warning signs. Most seborrheic keratoses are entirely silent. No pain, no bleeding, no symptoms at all beyond simply being visible. Some people do notice mild itching, especially if the SK is being irritated by clothing, jewelry, or scratching. Occasionally, if an SK gets snagged or scraped on a seatbelt, a necklace, a towel, it can become inflamed, crusted, or even bleed a little, which can be alarming even though it's usually just local irritation rather than anything sinister. Now here's the part I want every single person listening to remember, because it's the most important clinical point in this entire speech. Not everything that looks like a seborrheic keratosis actually is one. There is a rare but well-documented type of melanoma, the most dangerous form of skin cancer, that can closely mimic the appearance of a seborrheic keratosis. This is sometimes referred to in dermatology as a melanoma masquerading as an SK. It's uncommon, but it's exactly why doctors take new or changing pigmented spots seriously rather than assuming. So what should make you pick up the phone and get a spot checked rather than assuming it's just one of those SK things? A spot that is new and appearing rapidly, especially if you're not someone who's had SKs before. A spot that is changing, growing quickly, changing color unevenly, developing an irregular or notched border. A spot that bleeds spontaneously, without an injury, or that won't heal. A spot with multiple colors within it. Blacks, browns, reds, blues, whites mixed together. Any spot your gut tells you looks different from your other spots. Dermatologists call this the ugly duckling sign, and it's remarkably reliable. If any of that describes something on your skin, please don't self-treat it, and don't wait. See a doctor, ideally a dermatologist, and let them look at it properly. This is not meant to frighten you. The vast majority of spots that look like SKs are, in fact, exactly that. But that small minority is precisely why a proper evaluation matters before any at-home treatment enters the picture. Diagnosis and medical evaluation. So how do we, as physicians, actually confirm that a spot is a seborrheic keratosis and not something else? Most of the time, it starts with something wonderfully simple: looking at it. Experienced clinicians can often diagnose a classic SK just by its appearance. That waxy, stuck-on, slightly warty texture is quite distinctive. To look more closely, many dermatologists use a handheld magnifying tool called a dermatoscope. Think of it as a specialized magnifying glass with a light source that lets us see patterns in the skin invisible to the naked eye. Tiny structures like milia-like cysts, small white or yellow dots, and comedo-like openings, tiny dark plugs, that are classic reassuring features of a benign SK. This exam is painless, quick, and doesn't require any needles or cutting. If there's any uncertainty at all, if the spot doesn't look textbook, if it's changed recently, or if the patient's history raises any concern, the next step is a skin biopsy. This means numbing the area with a local anesthetic and removing either a small sample or the entire lesion, which is then sent to a lab where a pathologist examines the tissue under a microscope to confirm the diagnosis definitively. This is genuinely the only way to be 100% certain, and it's a low-risk, well-tolerated procedure typically done right in the office in a matter of minutes. I want to underscore why this step matters for our topic today. Any product that promises to dissolve, freeze, or peel away a skin spot at home works on the assumption that you have already correctly identified what that spot is. A gel doesn't know the difference between a benign SK and something that needs a biopsy. Your dermatologist does. That's the value a medical evaluation adds before treatment of any kind begins. Treatment and management, the real evidence on the gel. Now let's get to the heart of what brought many of you here, the gels, solutions, and creams marketed for removing seborrheic keratosis at home or in a clinic. What does the actual evidence show? First, an important distinction: medical treatment versus cosmetic removal. Because seborrheic keratoses are benign, in the vast majority of cases, treatment is entirely elective and cosmetic. Insurance typically won't cover removal unless the SK is genuinely symptomatic, irritated, catching on clothes, repeatedly bleeding, or unless there's diagnostic uncertainty requiring biopsy. This matters because it reframes the conversation. This isn't usually a must-treat medical necessity. It's a personal choice about appearance and comfort. Now, the specific product many people are asking about, the FDA-approved hydrogen peroxide topical solution, sold under the brand name Escata, which is a 40% concentration hydrogen peroxide solution, applied by a trained healthcare professional in office. Importantly, this is not a shelf product you rub on at home yourself. It was approved by the FDA in late 2017, specifically for raised seborrheic keratosis lesions. Here is what the clinical trial evidence actually shows. In 2 identical, rigorously designed Phase 3 studies, randomized, double-blind, and placebo-controlled, which is the gold standard for testing whether a treatment truly works, patients received up to 2 treatments of this solution 3 weeks apart. The results? Roughly half of treated lesions achieved complete or near-complete clearance, compared to only about 7% in the placebo group. On the face specifically, clearance rates were even higher, around 2/3 of lesions. So, yes, there is real, published, peer-reviewed evidence that this specific medical-grade solution can meaningfully clear seborrheic keratoses. That's the good news. But, and this is the evidence-based caveat that matters, the treatment comes with a notable side effect burden. In these trials, the overwhelming majority of patients experienced some skin reaction within minutes of application. Redness in essentially all patients, stinging in the high 90th percentile, swelling, scaling, crusting, and itching were all very common. Roughly 1% of patients experienced more serious skin reactions like erosion or ulceration. And there's a specific serious safety warning. If this concentrated hydrogen peroxide solution contacts the eyes or mucous membranes, it can cause chemical injury to the cornea, severe eye pain, and in rare cases permanent eye damage, including blindness. This is precisely why it's administered by a trained professional under controlled conditions, not something to be applied casually at home. So when a product marketed online or on a shelf claims to be the same gel dermatologists use or promises comparable results without professional supervision, evidence-based medicine tells us to be cautious. The FDA-approved solution that has actual trial data behind it is deliberately restricted to in-office, professional application. That restriction itself is part of the evidence. The clearance benefit and the risk of significant skin and potential eye injury were considered close enough together that unsupervised home use was not the approved pathway. What about other over-the-counter SK removal gels, creams, and patches sold for home use? This is where I have to be honest with you. For the large majority of products marketed directly to consumers online, the ones promising a gel will simply melt away your SK overnight, there is little to no rigorous, peer-reviewed clinical trial evidence supporting their claims. Many rely on testimonials, before and after photos of uncertain origin, or vague natural ingredient claims, rather than the kind of placebo-controlled trials that gave us the actual data on the FDA-approved solution. Some of these products also contain acidic or caustic ingredients that can genuinely cause skin irritation, chemical burns, or scarring, without the safety monitoring a clinical setting would provide, and without any guarantee they're even removing the right kind of spot. Other established in-office treatment options, the ones with the longest track record, include cryotherapy, freezing with liquid nitrogen, quick, commonly used, effective, though it carries some risk of lightening or darkening the skin afterward, particularly in people with deeper skin tones. Curettage, gentle scraping off of the lesion under local anesthesia. Fast, effective, done in office. Electrodesiccation, using a mild electrical current to dry and remove the lesion, sometimes combined with curettage. Effective for thicker lesions. Shave excision, physically shaving the raised lesion off level with the surrounding skin, sometimes sent for pathology if there's any uncertainty. Each of these has its own trade-offs in terms of healing time, risk of scarring, risk of pigment changes, and cost, and the right choice really is individual. Which brings me to the point I want to make as clearly as I can. Treatment decisions here should be personalized, made together with a dermatologist or your physician, who can look at your specific skin type, the location and size of the lesion, your cosmetic goals, and your risk factors, and help you choose the option, including the entirely reasonable option of doing nothing at all, that fits you. Prevention and healthy habits. Can you actually prevent seborrheic keratosis? Honestly, not entirely. Genetics and aging play too large a role for any lifestyle change to promise full prevention. But there are things within your control that are worth doing anyway, for your skin's health broadly. Sun protection. Daily broad-spectrum sunscreen, protective clothing, and shade-seeking may reduce the burden of sun-related skin changes over your lifetime, SKs included, and this habit protects against genuine skin cancers as well, which is reason enough on its own. Routine skin self-checks. Once a month, take a few minutes to look over your skin, including your back and scalp with the help of a mirror or partner, and get to know what's normal for you, so you notice quickly if something new or different shows up. Annual skin exams, especially if you have many moles, a family history of skin cancer, or a personal history of significant sun exposure. An annual professional skin check is one of the simplest, most effective things you can do for early detection of anything more serious. Gentle skin care. Avoid scrubbing or repeatedly irritating areas where you have existing SKs, since irritation can occasionally trigger inflammation or bleeding in an otherwise stable lesion. None of this is about anxiety or vigilance for its own sake. It's simply good, unglamorous, evidence-based skin health, the same habits that reduce your risk of the skin cancers we actually do need to worry about. Common myths and misconceptions. Let's clear up a few things I hear constantly in clinic. Myth: seborrheic keratoses are contagious. Fact: they are not caused by a virus or bacteria in the way, say, warts sometimes are. You cannot catch one from another person, and you cannot spread yours to someone else. Myth: if I have a lot of these, it means something is wrong internally. Fact: generally, no. Having multiple SKs is simply a common feature of aging and genetics. There is one rare exception worth mentioning for completeness. A sudden, explosive eruption of many new seborrheic keratoses over a short period has, in rare case reports, been associated with an internal cancer elsewhere in the body, something dermatologists call the laser trela sign. I mention this not to alarm you since it is genuinely rare, but because it's exactly the kind of unusual pattern, many new spots appearing suddenly, that deserves a doctor's evaluation rather than assumption either way. Myth: a home gel is basically the same as what my dermatologist uses. Fact: as we discussed, the one FDA-approved topical treatment with real trial evidence behind it is applied by a trained professional in a controlled setting, specifically because of its potency and its side effect and injury profile. That is meaningfully different from an over-the-counter product with limited or no equivalent clinical testing. Myth: if it's benign, there's no reason to ever get it checked. Fact: the lesion itself may indeed be harmless, but the judgment of, is this actually benign, is one worth getting confirmed, especially for a first-time evaluation of any new or changing spot, precisely because rare mimics of melanoma exist. Myth: removing an SK will definitely leave a scar. Fact: not necessarily. Many removal techniques done properly by an experienced clinician heal with minimal to no visible scarring, though outcomes do vary by technique, lesion size and location, and individual skin healing. If there's one thing I want you to walk away with today, beyond the facts and the studies, it's this: your skin is worth paying attention to, but it is not worth living in fear of. I see patients regularly who have quietly worried about a spot for years, almost too embarrassed to bring it up. And I see patients who've bought 3 different miracle gels off the internet, trying to solve it themselves rather than asking a professional. Neither path serves you well. The comfortable middle ground is simply this: if something on your skin bothers you, whether because it looks unusual or because it bothers you cosmetically, say something. Ask your doctor. It costs you a few minutes of a visit, and it either brings you real reassurance or it catches something that genuinely needed catching. Both outcomes are good outcomes. I also want to gently push back on the instinct, which I understand completely, to reach for the fastest, cheapest, most private solution, ordering something online and dealing with it alone in your bathroom. I understand the appeal, but your skin and your eyes deserve the same evidence-based standard you'd want applied to any other part of your health. You wouldn't want your blood pressure managed by an anonymous online testimonial. The same standard is worth holding for your skin. So, can a gel clear a seborrheic keratosis? The honest, evidence-based answer is sometimes, under the right conditions, with the right product, applied by the right person. There is real peer-reviewed evidence that a specific, FDA-approved high-concentration hydrogen peroxide solution applied in a doctor's office can meaningfully clear these lesions, alongside a real and well-documented set of side effects that make professional supervision, not a bathroom counter application, the responsible way to use it. Beyond that one approved option, the broader marketplace of consumer SK removal gels is, for the most part, thin on the kind of rigorous evidence that should guide a health decision. Here is the takeaway I hope you carry out of this room today. Seborrheic keratosis is common, it's benign, and in the grand scheme of your health, it is genuinely one of the least worrying things a dermatologist will ever look at. But precisely because it's so common and so harmless, It can tempt us into skipping the one step that actually matters most: a proper look by a trained eye before any treatment, gel or otherwise, enters the picture. Get it looked at. Ask questions. Make your decision about treatment, or about doing nothing at all, as a partnership with someone who spent years learning to tell the difference between harmless barnacle and something worth watching more closely. Your skin has carried you through every year of your life so far. It deserves that level of informed, unhurried attention in return. Thank you.